Hello, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches. Today is Friday, April 24th, and I'm here with Ed Brubaker, Living Branches President and CEO, for another one of our question and answer sessions. Hi.
Good afternoon, Alex.
How are you?
I'm doing okay considering what's going on.
There certainly is a lot going on. Maybe just to summarize as we start, I know people are always interested in understanding what our test results are from our coronavirus testing. So just to summarize that for you, at our Dock Woods campus, we do currently have 2 persons in Dock Manor, which is our subsidized housing area for seniors that have tested positive. We have 10 residents in Harmony House, which is our personal care memory care area that have tested positive. We have 1 resident in Dock Terrace, which is skilled nursing, who has tested positive. And we have 8 staff members who have tested positive, although 1 is already back at work. At our Souderton campus, we did also have 1 staff person who tested positive. They are also back at work now. And at the Willows, we continue to have neither a staff person nor a resident who's tested positive. So that's our summary, I guess, for the week.
And maybe just to interject on that too, Alex, when they're back to work, that means they're out of their quarantine.
That's a very good point.
We did not bring them back to work, 2 days later, but they were actually out as per the required time, past the time of their symptoms, et cetera. And so we're very pleased with that because studies would seem to show that once you have it, you may have some protection against it in the future. So those are positive stories.
Well, and I think there's so much negative about this in the news, of course, that it is hopeful to remember that, yes, most persons who are getting it are going to recover, and in this situation, will be back at work.
Right, exactly.
Yeah. So let's get started on our questions from our viewers. Our first one today is from Andrew, and he wants to know, a good question to start off with, how do we determine when we're testing residents and or staff?
Yeah, that is a good question. And I would say it's a confusing one, even for those of us who are dealing with it every day. In fact, just today at our CRT, Coronavirus Response Team meeting, we had, I would say, an extended conversation about this. Because in Harmony House, we did choose to test all residents. We did not choose to test all staff, and I'll talk about that in a moment, but we chose to test all residents. And part of the reason for that was we wanted to know what the extent of the infection rate was. And I believe I may have mentioned last week or in other times that we were pleased with less than 50% infection rate. The challenge, though, is it was Wednesday a week ago when we did the testing, and we got them back, the results on Friday. So I believe we had 8 additional, so a total of 10 out of the then 22 residents on Harmony House. Well, that pretty clearly told you an answer for those people testing positive. The challenge is it only gave you a date and time for the residents who tested negative. And so it was only a date and time for the positive too, but if you're positive, then you know that's not necessarily going to go negative until you go through the cycle of the illness and disease. But for a negative test, that means that day it was negative, but a person could be infected the next day or the following day or the day after that. And so that's part of the reason we chose not to test staff, all of staff, because we said if they're not symptomatic, we need them to be caring for our residents, first of all, but if they're not symptomatic and wearing a face mask, we are told by the county Department of Health and other health professionals that there's a low risk to that situation. So it didn't necessarily give you helpful information for staff because it didn't mean that the following week they were going to be fine. It just meant that day and time they were negative. So that was part of the thinking behind staff and not doing a wholesale review of staff. The other side of it then is the residents. And we chose to, in that case, test all residents, partly because we wanted to get a baseline. We wanted to know, was it all of them, less than half of them? Would that impact treatment? Those kinds of things. Would the sicker ones be in this area? The ones that were asymptomatic in this area? So it allowed us to do that more. We didn't move people, but it did allow us to think about how did we allocate staff in those areas. Now in Doc Terrace, we only had one person test positive, another negative, so we knew that it wasn't everywhere. So at this point, we are still not testing all residents in Doc Terrace or even the wing where it was. But to be perfectly blunt about it, it's something we're going to talk at every coronavirus response team, because our decision on Monday, to be honest with you, could be different than our decision today. And that's really what makes this so difficult. Literally, things that are coming out from the health experts are different from time to time because they're learning too. They're learning new things as well. And so we need to pay attention to that, but also first and foremost say, what is the importance and why are we doing the test? What information? So we felt it might give us more information in Harmony House about our residents and how we might treat them. Doc Terrace, there were some negatives coming back too. And so we weren't as convinced that that made a difference because we made that wing a coronavirus wing. And in addition, we opened up the COVID unit in the therapy room. So again, that may change next week, but the dynamics of each individual facility and each situation really determines what we may do. It may become the standard sometime, and I do think testing will be an important way to get to the other side of this, but it also needs to be testing that's quick turnaround. What was a few weeks ago or feels like 3 years ago, at that point in time, it could be maybe 5 days to get a test result. Well, by that time, it's way old news. But as we get closer and closer test results to the time of testing, we'll probably see more testing taking place as well.
I was talking actually with a family member about that, and the fact that because we're still waiting 2 to 4 days to find out is someone positive, is someone negative, that's not terribly helpful information when you're just trying to determine should this person be working. When we've got a 30-minute test, then that's going to be a different story.
Yeah, that's right. And the other thing too is we can get closer to 24 hours now, although we're struggling a little bit with that, but we're trying to identify laboratories that can do that for us. And so those things are changing too, but that really quick test, I think the Abbott test and some others as well, that will give us even better information in the future. The challenge still is the accuracy of the test. And so when you figure in the amount of times it may not be accurate, there's so many things to consider. And so I know and we all would love to say this is what it is, but we're learning literally new things each day. And so those are some of the challenges.
Well, and I think the other key thing you said in there was about the physical differences between the facilities, even literally the space. When we think about Harmony House, we think about an area that has a lot of common space and many residents who are very mobile, who are out walking very often during the day, versus a place like Doc Terrace and skilled nursing where there's not that mobility by residents. That alone could make a huge difference in how easily a disease is transmitted.
Yeah, that's a very good point too. And frankly, it's easier to keep the residents in their room in healthcare than it is in a personal care memory support area. And that's an excellent point as well. So there's so many factors to consider when we're looking at this.
Yeah, it's not easy.
No, it's not. It's not.
Our second question is, I've had actually multiple family members saying to me how much they appreciate the communication that we've been doing and our commitment to transparency during this time. Will you talk a little bit about your thought processes in really pushing us to be transparent in our communication in comparison maybe to what we're seeing from some other communities?
Yeah, and I think maybe I would first say I believe that transparency builds trust. Transparency, letting people know what the facts are, and telling them what they are. And so we feel that it's really important to let people know what's going on. And that when I say let people know, these are what I would reference as facts. How many people, have been tested? How many people tested positive? Because I think sometimes we can also say that transparency is just letting it all hang out. And that is not my personal definition of transparency, okay? My wife happens to be a good cook, so I don't complain about her cooking, but let's say she wasn't. A emotionally laden conversation is not transparency, and those are not ones that I would advise transparency in. So to say that this food was awful, in the first week of your marriage and can't you cook, that may be transparent and sharing your true feelings, but I would offer that it's not wise, okay, to say that, okay? So there's different levels of, when you think about transparency, it's about these objective facts, if you will, numbers of people, as opposed to things that are emotionally laden or are ones that maybe even be hurtful to people. That is not transparency. That's just being rude in many cases. So even the case as you take on the dinner example, to say that, wow, this chicken was really black and hard, that may be factually correct. It may not be appropriate to be that level of transparency in that. So when I say that, it's about those facts, numbers, but not a judgment call. When things become emotionally laden, that's where you're stepping on areas that it's probably not wise to go deep in those areas, whether it's in your personal life or professional life. But when we think about those facts that can be independently verified, the sky is blue, and assuming you're not colorblind, that's kind of verifiable, or the grass is green. Those are things that we can state. And for me to say, no, the grass is yellow, well, you wouldn't trust me, because that is a fact that is in dispute, and we want to be correct and clear with how we communicate. So I believe that non-emotionally laden facts, rather than opinions, but non-emotionally laden ones are ones that are appropriate to share, because while it may be emotionally laden to know someone got tested, for a person to not know that is much worse, I would say. To be calling the facility and saying, what's going on there? Did they get tested? Did they not get tested? What is the result? For us to hide that information would not do anyone any good. It builds trust. People trust us more when we tell them, we tested your mother and they were positive, or we tested your mother and they were negative. And I would suggest that if we're transparent, then they believe us when they say they were negative, as opposed to, oh, they're just trying to make me feel better. And so I just feel that with those kind of facts, it's important to give those facts, but also provide context where is appropriate as well, because just to throw out numbers with no context, for us to say there were 10 people in Harmony House who were tested and tested positive without the context of saying we did that and we're not required to do that, and most places are not testing in that sense, that gives the context to the facts. So there's being transparent, but also providing context. Very important. I talked to somebody who is down in Florida right now, and they said the facilities in Florida are not required to give any information. And it is changing now that CMS is putting out some edicts that we do need to show, but you can go on our website. Someone in Canada could look at our website and see our numbers. And in some ways, that can be a little scary, because it's like, well, we don't want them to think badly about us. On the other hand, if our goal is to be transparent and help people know they can trust us with both good news and bad news, we just believe we're going to be better off in the long term. And I think that's proven to be the case. We have wonderful families, wonderful residents, wonderful staff. And that is not to say that there hasn't been negativity coming our way, but I would say the vast majority of feedback has been, thank you for the transparency. And we just believe that's important to building trust, even if the numbers may make us look bad in comparison to somebody else, or in comparison to the facility that we know may have cases and there is nothing on their website about that. So it's a hard thing. It's a hard thing to do, to be transparent, because it is a risk, but I think it's important.
Yeah. A question I've gotten, this one specifically is from Carol, but I've had several people ask this. They are concerned to know, do we have enough PPE, especially for our care teams now that we do have areas with COVID?
Yes, and I would say at the present time here, Friday, what's the date today? The 24th, I guess. As of today, I can say that we have enough for the foreseeable future, whatever that may be, let's say definitely for the next 2 to 3 weeks. But we are constantly looking at that. We look at that as one agenda item every time we meet as the CRT. And we try to calculate what are our daily use rates so that we can say, here's our daily use rates. Here's our daily use rates when we have a COVID unit. Here's the numbers we have in inventory. How many days on hand do we have, those kinds of things. So we're constantly looking at that. And I would say early on in this process too, we were saying, how can we source more? And so I know I and others are constantly sending emails that we might be getting. I'm sure not all of them from sources that, are ones we want to pursue, like the ones that say, hey, bring your truck to the Long Island dock in Queens, and we'll be happy to load you up with some N95s. And we have had those kinds of emails. Okay, so we need to be smart about it, but Robert Buckman, who is our purchasing agent, is doing a great job with sourcing the masks and gloves and gowns and goggles and face shields and all that kind of thing. So we're fortunate in that regard because that also allowed us, when we had the COVID positive cases, we could fit test and get people outfitted and ready to go as quickly as possible. So very important, good question, but we're constantly looking at it. And as of now, I can say that I feel good about where things are at with PPE.
Okay, good. This question is from Jim. He is a resident in residential living at Satterton. And he says, I've been advised not to go to the pharmacy or the bank or even food shopping. I have a car and I can still drive. I like to do these things myself, but I am being told to have someone else do them for me. I feel that I'm being selfish by asking someone else to put their health at risk for my safety, and I feel a bit guilty about that. What would you say to Jim?
Well, I think the first thing I would say to Jim is, wow, you are like the salt of the earth. You're not thinking about yourself. You're saying, I want to do those things that are not selfish so I can be part of the community of Living Branches and the wider community. And I think that is tremendous, first and foremost. Secondly, I would say to Jim, don't feel guilty. I think I may have mentioned the other week in one of my videos about people saying, gee, I'm just sitting at home. I feel like I'm not being productive. That's your job right now, And so we're not going to prescribe what each and every person has to do, but our recommendation is, as much as possible, stay on site. Don't go off site. When you go off site, you have a potential of being exposed and bringing it back to the site. Now, the reality is others who bring that to you may be in that same category. But the reality is, too, this particular disease impacts older folks more than younger, and person with other comorbidities or other issues, health issues. But having said that, yes, if you have somebody, by all means do that. But if you're a resident that needs to do it on your own or isn't able to have those resources, you still need to eat. You need to get your groceries. You need to get your medications. You may need to go to the doctor, although telemedicine is a great, great alternative right now. So we're not saying we're not allowing anyone to leave campus. I know some facilities have said that locally. There was one in particular that I'm aware of. But I would say to Jim, don't worry. This is not the time to feel that guilt. But I totally appreciate where he's coming from and appreciate the sentiment that represents. But he should not feel guilty at all about having someone else do some of those things for him.
Good. And our last question is from, also had a couple of residents saying, we're doing what we should. We're wearing our face masks. We are practicing physical distancing. How long are we going to have to do this? And what comes next? So any thoughts about envisioning the future? I know you don't have a crystal ball.
Yeah, I absolutely don't have a crystal ball, and I don't know fully what comes next. But I do know this. We're not opening up bowling alleys today, okay? That was unwise, in my opinion. But even when Governor Wolf starts opening up things across the state, we're going to have to really be wise about how we do it in Living Branches, because it can't just be this open the floodgates. And no one's necessarily planning to do that even across the state either. But we've been kind of pent up for a while, and it gets old. And so we need to watch that, because families will want to come visit. People will want to interact with relatives. And unless the virus is gone, it has the potential of coming back. And so we're going to need to be very wise about this. So I know Governor Wolf had said I think construction May 1, some other parts of the state maybe May 8th. Honestly, I don't anticipate southeastern Pennsylvania probably at least through the end of May, but I could be wrong about that. But in my opinion, that's probably what it needs to be. I mean, we're seeing the cases start moving upward in Living Branches. That's not the time to be opening things up, okay? It's hard. I've said this in previous videos. It's really hard, but we need to stay disciplined because the population that lives in Living Branches are among the most vulnerable. And so I would envision, at least in the current state, until the end of May, but even after that, what is going to be the rollout? I know you and I were talking about the other day, what about the fall semester of Living U? That's probably going to look different. I know I'm personally not going to be running down to Citizens Bank Park for a Phillies game on June 2nd if it opens up June 1. That's just me. Other people can choose to do as they would like. But working at the place that I do, I also need to be smart about what I'm exposing myself to. So it's going to be a process. And I guess I would say this, while I don't mean to depress us, it's probably going to be longer than any of us would either envision right now or any of us would wish it to be. Because until there's a vaccine, until there's a treatment that treats it in an appropriate manner, this is going to be with us for some period of time. The other thing that I guess could happen too is the virus mutates and gets weaker or stronger. So there's so many things that could happen. And I would love for those positive things to happen, but I'm not going to make statements that they're going to happen if there's not proven facts and science behind it. So we're going to be in this for a while, but we're in it together. And we will make it to the other side. But in the meantime, it's a very surreal time. Just having that conversation with my wife Lucy about this surreal time. And the other thing I reflected is we're pretty fortunate in this country. When I think about pre-March and just the freedom of movement and travel and frankly things that I personally could experience, that there's people in the world that even what I'm experiencing now would say, I'll trade you. Any day of the week, I'll trade you for what you have now. And I think, wow, when can we get out of this? So it's perspective, I think, is part of this too, and saying, what is the perspective we're going to approach this with? And how can I be thankful for what I have now, even though it's not what I had before, and frankly may not be what I have tomorrow? So how do I live in that moment and recognize that and be thankful for it?
Yeah, that's a good question. We're all going to have to think about.
Yeah.
Well, let's end this week on a positive note. You must be hearing stories of togetherness and residents and staff just doing amazing things. I know I am. Do you have some that you'd like to share?
Yeah, I do have some thoughts on that. And I think that this week I want to focus on some things I've been observing or hearing about staff and their commitment. And, when I'm in the coronavirus response team that's chaired by Bruce Alder. I'm on that Skype call 3 days a week. I hear the stories of what's going on at Harmony House and now in Doc Terrace, and staff stepping to the plate. It's unbelievable. They're just doing whatever they need to do. And so, honestly, I don't even hardly know which day it was anymore, because I know there were some Friday nights that we were mailing letters and making phone calls late into the evening. And some of those people making those phone calls volunteered to do that because they had a connection with the families, and it's much better than having somebody make the call that doesn't really have a relationship. But that means the burden is greater for those people. So I know that people were here, 8, 9, 10 o'clock at night making phone calls. Or in the case of some people on your team, making phone calls from where they're quarantined to these family members. And so people are doing all those things, doing what it takes to make it happen, staying late, doing the things, making the connections, and just doing amazing work in that regard. But then we have the people on the units. Okay, it's wonderful. We have PPE. But have you ever worn that stuff for all day?
It's terrible.
I'm not wearing a mask now because we're appropriately distanced in this room. But when I'm in public in this shared service office or elsewhere on campuses, I'm wearing a mask. That's not full PPE. Full PPE is maybe even a face shield over that mask, perhaps an N95 mask that fits tighter around you and is more protective. Maybe it's goggles. Maybe it's a gown. It gets a little hot. Gloves. People are doing this that, frankly, we're not used to doing that on a regular basis. We're not a hospital. We're not used to dealing with that. And now, boom, all of a sudden our staff are needing to do that. It's a challenge, and they're making it happen. But one of the things that I would reflect too, when HR then, we had HR calling some staff the other night, and I'm going to have to put my glasses on here, but some of the feedback they gotten as the HR team was reflecting on what they heard as they were calling staff persons to let them know about the positive cases. The HR team reflected as they talked with people. They said they are truly core value employees. Almost every employee was much more concerned about the residents than about themselves. From Doc Terrace employees, this was after Harmony House was called the week before, but Doc Terrace employees said things like, "We've got this. We'll do whatever it takes. I'm afraid, but I go in for my residents. I'm concerned for my residents. I'm praying for them." You can't ask for much more than that. You really can't. And I also got a note, this was from a Harmony House staff person, and she'll write me notes periodically about different things. This particular note, her first sentence in the note, and it was in a thank you card, but her first sentence was, "I appreciate the N95 masks that keep us safe." That was her first comment to me. And I look at that and say, we should be doing that. We need to be doing that. But she took the time out of her crazy schedule to write a note thanking for this basic PPE equipment that we provided and should be providing. That's the kind of people we have working for us. And when I think about the people that watch this video, I'm sure it's staff people, it's families, it's others. And so for this, I would say to the families, these are the kind of people that are next to your loved one each and every day. They love the people they serve. And I just can't tell you how special a group of staff persons we have who are so committed to making this happen in an incredibly challenging time. And that doesn't mean they're perfect. That doesn't mean they don't get down and depressed. But at the core, they love and are committed to those who we serve, our residents. And so for me, as the CEO, it's just, it's very heartwarming and gratifying and humbling to see that level of commitment.
It's been interesting for me taking these test results and putting them on the website, because you're summarizing this complex relationship in these numbers. And I don't feel that that really shows what each of those numbers mean. And so I do want families to hear the things that we hear, to know that these are not numbers to us. They are people, they are our residents, and we love them and are so committed to doing everything that we can to help them every day, not just coronavirus days, but every day, to have the best experience that they possibly can.
Yep, that's very true.
Well, thank you for listening. We'll be back again next Friday. In the meantime, please remember, if you have questions that you'd like to send to us, you can email them to us at coronavirusquestions@livingbranches.org. Information is always on our website at livingbranches.org, and you can find us there as well. Thank you.